Oksana has connecting now, has connected already.
Okay, we can start.
Ladies and gentlemen, we are back to panel discussion. As we promised this morning in our opening official ceremony that we are going to have a panel discussion in order to answer and reply to your valuable question, which we have received through the general chat system from our platform. We have received over 10 questions. First of all, we were going to try to answer those questions, and we will be in live in order to answer your live question as well. If you would like to send your new question, our technical team will forward it to us in order that we can able to answer. I am today with our medical director, Dr. Ferhat Kayan, also our coordinator, Dr. Kristina Kowalczyk, and with our Russian Federation network office from Khabarovsk, from Krasnodar, and also, of course, we have our network office in Moscow and in St. Petersburg in Siberia, Altai region. They are unfortunately not able to attend today for our panel discussion, but they are following us carefully. Let me hand over the floor to Dr. Kristina. She can introduce our local network offices where are serving in Russian Federation region our client.
Mr. Amin, thank you for your introduction. I will continue in Russian.
Please go ahead.
Уважаемые коллеги,
Dear colleagues, I'm happy to welcome you at today's panel discussion. We are conducting this panel discussion as part of our medical travel congress, and I'm very happy to introduce participants. Dr. Ferhat, our medical director, has already been presented. I will present to you Pavel and Svetlana. They will help us today to answer all your questions, the questions that we received from you today during the webinar. I already have these questions and we will distribute them now. So every representative office will be able to share their own experience. So question number one, and I will be the one actually answering this question. So the question is, what kind of support do you provide to patients? I would like to answer briefly about how THCC can help patients and how you can set up treatment in Turkey. First of all, we have representative office in different countries and in different cities, and we collect data about the patient, or we collect the data from the doctor who is in contact with the patient. All the lab and other tests, medical history, all of this is collected into one file, and it is sent to a THCC representative in clinic in Turkey. Depending on how complex this issue is, whether it's just diagnostic or rehabilitation, or whether the case requires some surgical treatment, the representative can send a request to 1, 2, or 3 clinics, and he can offer 1 or 2 or 3 alternative treatment options, treatment or rehabilitation. He can offer this to the patient. While in Turkey, the THCC representative will be able to help the patient when he's in Turkey at all times, 24/7, and they will be able to help with any issues that the patient may have. After the patient is back to his home country after treatment, of course, representatives are in touch with the patient. If the patient has extra questions about the period after treatment in their own country, of course, a THCC representative can get in touch with the clinic once again, or he can set up an extra online consultation, and he can solve all the issues that the patient needs. So I think that this should be a sufficient answer for question number 1. If you have any additional questions to clarify this question, we can continue. Next question. This question is either from the doctor or from the visitors of our webinars. Is prepayment required? This is the question. I would like to address this question to one of our representatives, for example, Svetlana. Svetlana, please answer this question. So it was either the patient or the doctor who was asking this question. Hello, of course, Christina. Hello, colleagues. No prepayment is required. The payment is done by the patient him or herself in the clinic after the treatment. Okay, thank you so much. Thank you. And I would like to add a few words, if you don't mind. You are 100% correct that the patient needs no prepayment either to the THCC representative or to the clinic. But sometimes patients may have some surgery planned and they are worried about thinking or about payment and so on, and they decide to make a prepayment while in their own countries, but this happens very rarely, and this only happens if the person him or herself wishes to do so. And once again, no prepayment. Next question continues the previous question. So to whom do patients pay, THCC or to the clinics directly? We have already started answering this question, so I will continue. A THCC representative accepts no prepayment in their country for treatment. All the payment goes directly to the clinic. And if the patient needs that, the patient is provided with a special form to pay for his entire treatment. Next question. Probably Dr. Farhad will be able to answer this question. So it's a medical question. Question is, how much time is required for rehabilitation after hair transplant? Dr. Farhad, the floor is yours.
Okay, I will tell you one more time in English.
Please.
If you're a little bit, maybe,
Please.
yes. Our doctors, our patients are asking how much time patient needs for rehabilitation after hair transplantation.
Okay, good question. Normally first of all, hi to everybody from Antalya, okay? And now after hair transplantation, if the clients ask that what time can they go to their daily life and for business, after 3 days they can go, okay? But for the hair improvement and rehabilitation for the head is about 10 days.
Yes.
But in 3-4 days, they can attend to their daily activities and to their business.
Yeah, thanks, Dr. Farhad, for your good answer. So we will continue in Russian.
Okay.
Следующий вопрос.
Next question. What kind of treatment in Turkey are popular among the Russian patients? Thing is that we have doctors and visitors from Russia today. So this question comes from our doctors. I believe that we can ask this question to you, Pavel. Thank you. Thank you so much. My name is Pavel Antipov. I'm the head of THCC office in Samara and Kazan, and I will be happy to share information and experience of the patients from our region who, for several years, have been undergoing rehabilitation and treatment in the best clinics and spas and resorts in Turkey. First of all, people are interested in oncology, orthopedics, ophthalmology, stem cell treatment, of course, dermatology, because Turkey, in my opinion, is an undervalued region when it comes to spa and resort treatment. And more people are using these services. The leading clinics deal checkups wonderfully. We had patients who wanted to combine vacation with their medical checkup, and our the doctors identified some health issues. In this case, they provided with recommendations, and they saw doctors here in Russia upon arriving back. So this is the list of the issues from our region that patients have. But I would like to say that we receive requests for all kinds of areas and problems, and the most difficult ones are cardiovascular diseases, plastic surgery. It's also in very high demand. And people also ask us for this kind of treatment as well from the patients from our region. I don't know a single case when the Turkish clinics were unable to accept or help, and we can receive an answer on any problems from our Turkish colleagues. Thank you, Pavel. We continue. Next question is for the head of the association, Mr. Emin. The question is, how many patients go to Turkey for treatment? I think that what people meant here is per year.
Should I translate you question? How many patients, Russian patients, are coming for treatment to Turkey? I think it's about 1 year, during 1 year period.
Voice.
Mr. Min, we don't hear you.
Yes.
Yes.
Yeah. Actually, before pandemic problem start in 2019, before pandemic period in 2019, among 1,087,000 international patients arrived to Turkey from 165 countries. Among of them, around 75,000 Russian Federation region patients arrived to Turkey for different treatments, but majority, as from other CIS country, majority are coming for cancer treatment, oncology treatment. Especially in the children's side, there is a bone marrow transplantation requirement is very high as well from Russian Federation, as the other from other CIS countries as well. We are receiving from Russia mostly very heavy treatments, very limited number of people traveling from Russia for aesthetic surgeries or for eye surgeries or for dental surgeries. Mostly they are coming for oncology, cardiovascular, transplantology for liver transplantation, kidney transplantation, as well as bone marrow transplantation, and orthopedic problems like knee replacement, hip replacement, and some other specific diseases also. We do have a treatment for other special interests like alcoholic people they are requiring for kind of long-term of treatments in our special resorts and special places where they want to change their habit of using a lot of high level of alcohol. Also, we do receive for rehabilitation for alcoholic and narcotic rehabilitation as well from this region. So these are very specific areas where we do receive patients from Russian Federation.
Mr. Amin, which cities mostly Russian people are choosing for treatment? I mean, they compare with rest, for example, in Antalya, or mostly they come just exactly for treatment to Istanbul and other cities?
Well, as our medical director, very experienced with Russian patients in Antalya, because he was leading he was the owner one of the leading hospital in Antalya region. Since almost 5 to 6 million Russian citizens are coming for holiday and vacation, mostly to Antalya. I mean, I can say that 95% of this population are coming vacation to Antalya. The rest, 5% or 10%, they go to Bodrum, Marmaris, some other region, but mostly their main destination is in Antalya. That's why Antalya region is well-known destination for them for tourism. When they are selecting a treatment destination, they prefer, obviously, to go to Antalya because the weather condition is much better and mild and etc. But of course, some of specialty, very special surgeries, very heavy surgeries, and some specialties are not being able to perform in Antalya, then we refer the patient to Istanbul or to Ankara or to Izmir, other big major cities where we have our university hospitals and our general hospitals which can accept this kind of patients.
Okay, thanks a lot for your answer. And I would just say a small word that really we are very lucky that we have such medical directors in our THTC council, because as Dr. Farhat, he always can help to all our representatives, to all our directors to direct and to choose the best treatment, the best doctor, the best clinic for our patients. As you mentioned about his huge experience in collaboration with patients from different countries. So thank you a lot for your answer. I will continue again in Russian.
Please go ahead. We are following you.
Thank you.
So the next question, and I would say that it is not even a question, but it's a different variant of the question. So the question is, it would be interesting to cooperate with Turkish doctors. Is it possible? Answer, yes, it is possible to cooperate with the Turkish doctors. And it would be easier for me to answer this question if I knew if it was the patient or the doctor who was asking this question, or maybe a company. For example, if you're a doctor and if you want to cooperate with Turkish doctors, for example, for experience exchange and for trips, it is possible because Turkey is always ready to share their experience and everyone is aware of the Turkish hospitality. So, of course, Turkish doctors are always happy to share, to show, and they're always ready to provide consultations to doctors from other countries in case there are some difficult cases. So if this is what you want, you can go to the representatives in your region and we can discuss all sorts of cooperation with you, cooperation with Turkish doctors. The next question is this. Please describe the patient's route from the first contact with THTC to when he comes back home. What is the role of THTC in organizing the treatment process? I have already answered this question a little bit at the beginning of our discussion, and I mentioned the patient's way and how THTC, what role it plays in this. But once again, I can say that an THTC representative collects all the information about the patient first. Then they help the patient to forward all the information to the clinic, then to select the best doctor, the best clinic, the best treatment method for the patient. After that, when the patient comes back home from the clinic, they keep in touch with the patient to help solve all the issues and all the problems that the patient may have after the patient is back home. For example, for surgery, the person needs some sort of rehabilitation. Also, and so this is as far as a representative and the patient goes. If we speak about THTC representatives who work with doctors, then of course, after the patient is back from successful treatment in Turkey, the THTC representative pays the new remuneration to the gratitude remuneration to all the doctors who refer the patient to treatment in Turkey. If you have any other questions about this, we will be happy to provide answers. Next question. Please tell me, how do you solve the situation with the language barrier if such a barrier exists? I would like to refer this question, for example, to Svetlana. Svetlana, if you can answer this question, please do. Yes, of course. I want to say that the language barrier is totally absent because every clinic has a sufficient number of interpreters. The patient meets a Russian-speaking coordinator. He supervises the patient during the entire process of treatment. Thank you so much for your reply. I think this is a full answer to this question, and we'll continue with you. Next question. So again, this question is about is medical in nature, and we would ask Dr. Ferhat this question. The question, to be honest, is a little bit unclear. Dr. Ferhat.
Like how much cost implant, but maybe it was patient and he couldn't mention which type of implant and what he needs. That's why I think it will be very hard to answer for such question because there is a lot of different implants in our body.
No, we can give approximate prices. Okay, we can say it depends to the brand. Of course, from the country, original country-made brand, and then we can say it between $1,000 and $1,500. But this is not only the implant, also including the top cover of the implant. Mm-hmm. We can say between $1,000 and $1,500.
Okay, thank you a lot. Thank you for your answer. I will continue in Russian. И я думаю, что это на сегодня.
So I think that was the last question as of today. The following question, and we received a message and not a question. One person is interested in thermal spas in Turkey. I would once like to refer this question to Pavel. Pavel, will you be able to help us with answering this question? Yes. I would like to say that the spa complex and treatment in Turkey is in very high demand right now. Traditionally, for many years, we have seen Turkey as a destination for beach vacation, but actually there are different thermal springs that have a lot of useful components that help people treat many difficult diseases. These places were discovered around 2000 ago by the ancient Greeks already. And some people say that Cleopatra herself visited the places which are now in Pamukkale. This is the continental part of Turkey. And she visited these places to look younger. But if we speak about specific diseases which can be treated at spas of Turkey, then these diseases include some orthopedic diseases and gastrointestinal diseases, all kinds of stomatological diseases. And actually, the central part of Turkey has a lot of thermal springs, and some springs have a lot of sulfur. So people prefer to come here to treat skin diseases and diseases related to orthopedics. And for example, near Orbagaj, there is unique water that is very efficient for treating digestion problems. Several of our patients went to Kangala resorts, and these resorts are a unique opportunity to treat all sorts of dermatological diseases, including, thanks to the so-called doctor fish, they help to treat all kinds of severe skin diseases. You must remember that while selecting a certain treatment or a spa, you need to have recommendations from your doctor. Then we refer this information to the specialists of the spa. A course of treatment is negotiated. We give all sorts of recommendations because we understand that there is a disease, and at the same time, there is a risk of transferring this disease to other patients, which is why professional individual approach, safety are the main principles in treating these kind of patients. Another thing that I would like to add is that Pamukkale is one of the most famous spa resorts right now. And of course, you can go there if you rent a car or if you travel by taxi. But in order to increase the flow, so to say, and provide people access with free use of these unique resources, the Turkish government is investing big money in creating entire cities with hotels and logistic points around this area. For example, Pamukkale is in between Ankara and Antalya, and I know that there is a plan for the future to build a high-speed highway which will connect this wonderful resort to Antalya on the one hand and to Ankara on the other hand. And even visitors to Antalya will be able to drive just 1.5 to 2 hours, and they will be able to come to Pamukkale to receive these unique procedures and then come back to their own hotel. So this truly is efficient, it's convenient, it's pleasant, and it's nice. Thank you, Pavel. Thank you, you are right. An increasing number of opportunities for our tourists are appearing, and opportunities open up for those who not only want to get treatment, but who also want to be healthier. Thank you so much for your answer. As of now, these are all the questions that we had from our B2B meetings. And I believe that we will have extra questions tomorrow. So if we have a lot of questions, tomorrow we will make another panel discussion to answer all of your questions. But of course, you can send us your questions. You can get in touch with the representative of THTC, the representatives who you see right now. But if you're not from Russia, or you're from another city or from another district of Russia, you can visit our website. Our website has all the contact details about all our representatives. You can send them an email, or you can get in touch with them through social media, and they will be able to provide you with an answer to all your questions related to treatment, rehabilitation, and diagnostics in Turkey. Also, I would like to invite everyone to sign up for B2B meetings and get a detailed opportunity to talk to clinic specialists and receive more answers about treatment from clinic representatives themselves. All of this will enable you to broaden your perspective when it comes to treatment in Turkey, and it will provide you with the opportunity to build partnership relationships with clinic and with the THTC. Thank you, Pavel. Thank you, Svetlana. Thank you, all the people who were unable to join us, but who tried. Dr.
Time for your answers. Mr. Amin, thank a lot to you also. We finish all our questions and we invite all our buyers to join B2B meetings and to get more answers for their questions about treatment, about cooperation with THTC and clinics. So thanks a lot to all, and I give to you to finish the opportunity to finish our today panel discussion.
Right. Thank you, Dr. Christina, for your contribution. It was very fruitful and very informative. All the information I have followed up by simultaneous translation. Your talk. It was all correct. Direction given to our listener or the questions being asked. Thanks to Pavel of contribution for thermal and medical spa centers. He had his experience. He has shared his valuable experience as well. Of course, Svetlana and Oksana, our new directors in the region, in different cities, and we have also Elena has connected us lately. I think she's already here with us, listening and following with us from Siberia, from Altai region. We are looking more representative from Russian Federation, from other cities. Actually, at the moment, we have in Moscow, we have in St. Petersburg, and we have in Krasnodar, and we have in Khabarovsk, we have in Kazan and Samara, and Siberia, Altai region. But of course, Russia Federation is much bigger than these cities. We are looking forward to collaborate with new candidates who are willing to be our representative, be a representative of Turkish Healthcare Travel Council. I want to add in this panel discussion one more topic that all doctors and travel agent from Russia Federation has different opportunity of cooperation. I mean, they can, of course, much easier for them to contact the regional director of Turkish Healthcare Travel Council to be follow up their patient closely, and same language speaking people and understandable, the same behave, the same culture. But also they have the options that they can deal with our other travel agent, medical tourism travel agencies who are facilitator. They can build kind of partnership. Also, they can build partnership with clinics and polyclinics. But I believe much easier for them that they deal with a local representative of this institution, a local representative of these clinics, these hospitals, or this agent or our council. Most of them, they have a local representative also. So it can be more easy for them to follow up and to care about their patient in order to control everything according to regulation and according to the system which need to be follow up for medical tourism and for follow-up of patient. Once again, I would like to thank to our Dr. Ferhat Kayan joining and contribution his experience as well. Thanks to Dr. Christina, Pavel, Svetlana, Oksana, and Elena for their participation. As Dr. Christina said, if we receive many more questions today and tomorrow to our platform, we can arrange another panel discussion in order to reply your questions, not to keep anything non-replied or not answered actually by our side. Again, wish you successful events and B2Bs. I again invite our visitors, doctors, travel agencies, please register to B2Bs and request meetings from our representative offices and also our exhibitors, clinics, polyclinics, which is already in exhibition section, and travel agencies, medical tourism accredited travel agencies, which is registered in our platform, in our exhibition, online exhibition. So you are free to deal and free to build a partnership with any of this institution. We are here anyway for your service, and we are here to serve you, to make you happy and make your client and your patient happy and healthy, get their treatment with best opportunities and best prices and affordable prices, what we can offer and what we can do actually. Thank you very much once again, ladies and gentlemen, for participating, and let's keep in touch. Thank you.